Hey, it's Dr. Kimberly. I am here today just to do a quick blurb on what to do if your child chips their tooth. It varies depending on whether it's a permanent tooth, a baby tooth, how big the chip is, their behavior, all the things. A lot of times if it's a little teeny tiny child and they have chipped and it's chipped a spot and it's just a little spot, it's not bothering them, it's not rough to their tongue, a lot of times we'll watch it because at that point, behavior is an issue with little itty bitties. They don't like to sit still. They definitely don't want you in their mouth trying to smooth something down. So in those cases, if it's minor, we'll just monitor it. If it's a baby tooth and they're a little bit older, sometimes they chip them because they're just loose and there's not a lot of tooth left. So at that point, we usually just take those baby teeth out. If it's a permanent tooth and they've chipped it, then we 100% will build it back up and make it look like the normal tooth to get them back to normal so they're not walking around with a snaggle tooth in the front. So it depends, and it's kind of a case-by-case basis. Usually, I will say, especially these things tend to happen after hours and on the weekends because kids just like to stress their parents out with stuff like this. So if that happens, we have an emergency line. Call the emergency line. Most of the time, I will get you to take a picture and send it to me so we can get a game plan together. And then depending on sort of what has happened and what we need to do, then we will schedule and get everything fixed appropriately from there. So if you ever have an emergency or you need anything, please call us. It's 843-284-6497. Thanks.